see that fellow that I was good.
No, yes.
But he's not committing. He says he's got the alliance meeting at the same time.
No, he must meet you.
No, let's leave it. You live to see November.
I doubt it. I'll go. It's going to disappear.
All right. We'll talk.
Good luck.
Yeah. All right.
Good afternoon, colleagues.
So, just the
Sincere apologies. Sincere apologies for the delayed press briefing. The minister had to meet and resolve certain issues. I'm going to request the minister, Dr. Mzole, to introduce.
You know something we don't know.
Introduce members of the panel and address the media.
Thank you very much, members of the media. Let me start by apologizing. I'm sure you will appreciate the fact that we are going through a... I'm sorry. I'm sure you'll appreciate that we're going through a bit of a situation with quite a bit of urgent matters. And from that point of view, we have had a meeting, and so the issues were such that we've had to delay. I'm sorry, can I just sort this out, because I think my technology is causing a bit of a challenge here. I'm reading from it, so I need to switch it off. So we want to just indicate to you that we've just finished a meeting. This is a meeting of what we call net joint, where most of the security cluster members meet when we're dealing with issues of kind of emergency. And in there were also other ministries such as health and tourism. We were supposed to be part of it. So this group is also part of the response team that is focusing on the issues that relate to the outbreaks. So on my right you have ministers, Minister Naledi Pando. On my left, Minister for DIRCO and Minister Nkosazana Dlamini Zuma, Minister for COPTA, Minister for Home Affairs. And then we've also had other ministers who have been with us. Minister Tidiza for Agriculture, Land Affairs, who's also been excused. Minister Kubai from Tourism has also been with us, and we've also asked that she asked to be excused. And other deputy ministers who were part of it. Excuse me. Or Minister Gallo, who was here also because of pressing business, she has had to leave. So we have been looking at a number of issues that relate to the outbreak on the coronavirus. Let me just say upfront that on the issues that we discussed relate to the evacuation of South Africans who are in Wuhan. The report was tabled to the ministers, and we want to just say that the whole program of evacuation is still on course. We just got an update, so we continue to expect the members to move on with the plan as they'd agreed. We did say that on most of the issues relating to the evacuation, because of the fluid nature of some of the issues, the costing, the preparations, and all the implications, some of the matters will be best reported when everything has been completed. So we're just happy to say that everything is on course as we speak. The second aspect that we had to look at was the fact that this team was meeting now for the first time since we had actually announced the first coronavirus case last week, and so we were to look at the update, and in the meantime we to look at a number of issues. We are at the moment discussing various issues that are of concern. Amongst those are the approaches that have to be taken in dealing with people who are traveling from areas of high transmission, where we've already seen people who are infected from those countries into other countries. We've also had to look at the issues of the various concerns that have come in relation to major conferences and major sporting events, and therefore we're going through quite a number of consultation and discussions and information that has to be shared with the ministers. At the moment, we do not have any specific decision to announce at that level. However, after the various ministers would have finalized the issues, where necessary, they will be the ones who will issue specific statements, and where there's a consultation with the presidency, will also need to be going through that level, and on issues that will need to go to cabinet, we'll also be taking them up at that level. So we'll only be able to announce any specific decisions where they would be at the point when the necessary processes, cabinet processes, would have been gone into. So the number of questions that have been raised with us, we just want you to be aware that we're dealing with them, and that we need the correct processes and the process of decision making to be concluded, and then they will be announced within the correct protocols. If it's a department or a minister that has to make it, the announcement, or if he has to make a decision, that will be at that kind of level. So we want to leave it at that, and then say that the other issues that are going on right now, excuse me, is that a number of stakeholder meetings are going on where, for example, people are involved in hospitality industry, tourism, and so on. We're going to be having a lot of those meetings as we go along. For today, we also want to thank you as members of the media for the interest and the angles with which we have dealt with these matters of the announcements. We have announced yesterday, in the past few days, that we have a number of patients who have been tested positive, and yesterday the number stood at 3. We also did indicate to the public that the source of the infection seems to have come from a group that had visited Italy, that visited a town or a city of Livigno, and in the northern part of Italy, in the province of Milan, and they went for skiing holiday. So on their way back, we had 10 of them, but 1 went to the UK, so only 9 came back to South Africa. And in the process of those 9, the first one did take ill and showed symptoms and was diagnosed last week. We announced yesterday that another member of the same party that was traveling together, who was in Gauteng, who had flown from Italy to Dubai, and then from there to OR Tambo International Airport, did get admitted as well after testing positive. We've also then announced that the third patient was the wife of the person who was diagnosed in Pietermaritzburg in Hilton, and these were confirmed. We did also indicate that their conditions were healthy, and that the man who was the first patient was in fact feeling healthy, and so we left the decision to the doctors as to what the approach to treatment would be, in particular because he had indicated he had no longer had symptoms, and therefore was just being looked after by the doctor to await a point at which they would be turning negative. So those were announced yesterday. We therefore want to announce at this point that there have been further numbers of people who were part of this team who were found to have been positive. It will be noticed that these individuals had come in as couples, and therefore we had asked them to be on quarantine already at the time when the first one turned to be positive. So just to indicate at this point that 4 of them have also now tested positive. I'll try and give you a sense of how they are. One is a couple in KwaZulu-Natal, in the area around Umgungundlovu area, 38-year-old male and female. They've tested positive. They have been put on quarantine, and they had not yet been admitted to hospital at the point when we received the results. So they are, some of them, in fact, the lady had symptoms on arrival, but the gentleman did not have symptoms, but the tests have come out to be positive. So we are therefore going to have our team to round up all the contacts and also follow up to see who else needs to be approached. They were all traveling together. The second group, another person is a 45-year-old male, again in the area of Maritzburg. Amongst those contacts, we took these tabs, the test at that time, and after those swabs were taken, they came back positive. At this moment, that one also has some symptoms, and therefore it was also put on quarantine. They will also have to go for assessment by the doctor and get admitted at that point. The next one is another female. It's another male who is in the area of Pietermaritzburg as well. So this one again is a 38-year-old male who has been found to also be positive. Those who we have not mentioned were still awaiting the results for them to come back, so that we now are announcing that we have those numbers of people who are now testing positive. We also had another one case that was of concern to us, because this was someone who was in Northwest, in Freiburg, and initially were admitted with some symptoms, but in the context then when the first test was done, it created an impression that it was a very unclear, maybe weakly positive, and it was not clear. So we're a bit concerned that there could have been another person testing positive, but in fact we have now got a confirmation that this one is negative. We're only mentioning that one so that you do not have stories that move around, and you could someone would say someone was isolated, treated in isolation in Freiburg, and then we might think that there's a case that we might be unaware of. Well, that's why we're mentioning it. But we are quite comfortable that this one, as the results have come back to say it was weak positive. Now, weak positive could be anything. I don't want to get into that, but sometimes weak positive could mean that there could have been a cross reaction with some other virus that was in the body because she was not well. But then once you do a confirmatory test, then you ignore what the issue was before. It just simply tells you that the test was undecided at that time, but later it confirmed. So when the second confirmatory test comes along, then of course we work on that. So that is where we are, colleagues. We just want to say again that we will await the tests on the other outstanding members, and will announce them in due course. But just to be again upfront, that we are not surprised with these particular results. We think that the kind of exposure that these members had, if it was enough to create an infection in one person, it was most likely that all of them would have had a similar kind of exposure. We therefore believe that any positive report would not be a surprise. We'll wait for the others. What we are now focusing on is tracking all the contacts. As we indicated, we have already contacted a number of those who were located 2 seats ahead and 2 seats behind the flight, the seats of those who were in the were flying with the first patient. So from that point of view, we are on course with finding out on all of those. And again, we've said that the approach on this matter is that if anyone is suspected, we then test them and note who the contacts are. Once the person becomes positive, we then test the contacts, and when the contacts are positive, we treat each one of them as at the center of the circle. And then we will then go and test each one's contacts, and then until we can get to a point where we break the circle of positive results. Then we will then stop following that particular lead, and then we'll follow those where the results become positive. So at the moment, we're still on course, and we're quite comfortable that this is at the moment a limited situation of, at least we know the people who are involved. Yes, to what extent this would have gone to the rest of the other members of the public is something that we have to track and, and make sure we take through. What I think would be of importance now is to say that the people who are getting infected are having an experience of having been to countries other than China, which means therefore that we need to be more vigilant, because the infection could come from any other aircraft, it could come from any airline, and what we have to start watching is the infection at some point will become an infection where it's a local transmission, which means beyond the one person who would come from outside. Now, our people locally are the ones that are transmitting the infection. That situation is what we are watching out for, and therefore we'll continue to test all of these contacts. And then as soon as we say you are a contact that needs to be tested, then of course we recommend you to be quarantined, and then we'll look at the circumstances of the individuals. At the moment, it has not arisen that there should be any intervention on the quarantine, because we think that those circumstances under which people are quarantined are actually acceptable. Just to make a distinction, quarantine is when you are healthy and we want to do a test, and then we want to find out if you do have the infection or not. Isolation is in hospital, where we treat you in an area which is secluded from all other patients, and then in the process we're treating you in a way where there's a particular code of how the nursing happens. You have to have a protective gear, and you have to have limitation of contact with other people and other patients, and so on and so on. So that's why we make that a bit of a distinction there. So as we have indicated, we've also got our teams here. We're going to ask that some of the questions they could respond to you, but we just want to give you that kind of update at this point. We would be willing to deal with your questions, but as we have said, a lot of decisions are still going to be made in the relevant line function and cabinet, so there may not be much more that you might want to raise or answer on these issues, but we are open to just advise you where we are on this matter. At this point, I'm not sure if my colleagues might want to add anything, and then at that point we would also just like you to ask your questions, and we'll share them with the teams that are managing this, particularly from the Department of Health and NICD, as well as DIRCO, where a number of the issues are arising from. But all of us are open to your questions. Thank you very much.
Thank you, Minister. Do I have an indication of any comments from other ministers? No. Colleagues, I will take 5 hands at a time. Please introduce yourself. Please, can we take a maximum of 2 questions per person?
Sure.
Then we take other.
Minister Pando has to leave because of prior arrangement. We will have some officials. She wants to ask the minister first. Okay, that should be one question to Minister Pando, and then we'll allow her to leave. We did ask that she would be here for a few minutes.
My name is Sophie Pena from the South African Broadcasting Corporation, the foreign editor. My question is directed one to Minister Pando and then the second one to Minister of Health, Dr. Zwelinki's. Minister Pando, with all these developments, indeed, DERCO has to play a prominent role. We've seen cancellation of many international meetings. I mean, the G77 that was supposed to be in Uganda. You have the Commonwealth coming. You have 2 important AU meetings in April. You also have the SADC meeting much later. Maybe that one might be better. But from where we are now, what's going to happen? Do you have any sense of whether the Commonwealth will continue? And the 2 important AU meetings that we're going to look at silencing of guns and issues of trade and investment, and the delay in the perhaps opening offices of the African Continental Free Trade in Ghana. Where are we? What impact will that have? And then, Minister,
Let's allow Minister to answer. We'll
Let
come
me
back.
answer, 'cause I have to leave. Thank you very much, Minister. The arrangements with respect to May, end of May, the conferences you referred to, and then June and July remain in place. With respect to some of the other meetings, the governments have decided to postpone or cancel. Most are postponements. I think for most of the governments, the key priority at the moment is the health of their nations, and this is a correct focus. This is a serious health matter that we all must address with full concentration. And the key issue is to reduce risk, which is why the cancellations and postponements have been put in place. Where we've agreed with smaller meetings that we wish to proceed because of important decisions that need to be taken, the fallback has been the use of technology. So we're looking at video conferencing or other means of reaching out to each other and jointly making decisions, because there are means through which technology can be of great assistance. Perhaps this will be a method for the future, but the larger conferences have been postponed.
Okay, thank you very much. I think we should excuse Minister Pando, as we did expect that she would be leaving. So we could proceed with the next questions.
it's directed to Dr. Mkize. Dr. Mkize, the issue of self-quarantine and isolation, there are concerns that the self-quarantine, it's not helpful. The ambassador of China saying that you have to take stringent measures when you deal with a crisis like this. For example, those people who were coming from Italy, some of them went to work and they met staff members. There's a query or information in SABC's position that there's a concern from staff members in Pietermaritzburg or KZN, where the first person was identified that he had meetings with the staff members and perhaps they were exposed. And there are rumors of these others, clearly these other four, went on with business before today, and they met staff members, they met families, some of them had family gatherings. Therefore the risk, are we going to change tact? And also, are we going to have an emergency cabinet meeting to really come up with a comprehensive way of prevention now, because it involves many people and it will also involve budgeting, I guess.
Okay, the concerns about people who could have been met with the patients who have turned to be positive have been brought to our attention. We are aware, and there were specifics given to us as soon as we indicated what the status were on some of the people. Then, of course, these issues were brought to our attention. Now, those people who were met they fall into the category of what we call the contacts, which means that anyone that would have spent a particular amount of time with the person who's tested positive, or those who are within a particular distance, they become the contacts. Those are the ones that we will warn that you have been in close proximity to someone who has tested positive. Therefore, we're going to ask you to avail yourself for testing, and we're going to ask you to take a voluntary quarantine so that you stay indoors and not move out and mix with many people until we get the results of what your situation is. Now, home quarantine concerns, I'm not sure what your reference is with the ambassador of China, but let me just say, China in Wuhan, in Hebei province, when they said there was a lockdown, they said everyone must restrict their movement. They said people must stay indoors, and those who are in the universities, they must stay within their hostels and only go out to collect food and not mix with many people. And even when they do so, they use protective clothes and not spend long time at that level. So voluntary quarantine worked a lot in China. Not everyone was in hospital, and a lot of people were on a voluntary home quarantine. Now, in our situation, people must not misunderstand what has happened. Home quarantine is recommended once the doctor says, for these reasons, maybe your symptoms, maybe because you have been in contact, you must then restrict your movement and therefore go to home quarantine. But what had happened with these individuals, they were not on home quarantine. They were free agents. They were moving around. They were visiting. No one knew that they'd got infection. They were not sick. They didn't have any symptoms. So wherever they were, they thought they were free to move like anybody. Only when they were diagnosed and they were contacted as contacts, then did they realize that there was something wrong. In other words, anyone that they would have met prior to them being informed to do home quarantine, they would have then had to disclose those as the contacts, which means that we're not surprised that they met some people because they didn't know they had a problem. We also don't think that there's an immediate risk to those people, but we will find out when we test them. And so the fear of home quarantine is not necessary, because it's an advice that you get given after you have been either tested or being warned that you are on the list of contacts. So that is the time it starts. So we have not been aware of anyone who was put on home quarantine and then they started going gallivanting out there. We haven't had that. But what we've got is a situation where people would have met others before they were made aware, and after they were made aware, they've cooperated. So I think the concern should not be so much. What people need to understand is that we're precisely looking after that period, that before you were tested or before you were warned, all the people that you interacted with, you must disclose, because all of those people need to then come forward. So for example, in this case, the concern in Pietermaritzburg we are talking about is a matter that we discussed with Mr. Barnes, who is the school chairman of the school board. When we said to him, look, your children from your school are negative and the parents are positive, so we will take the parents, but the children are not coming back to school. Mr. Barnes said, no, that's very nice. So that means now they need to look at the parents and teachers who met these two patients before. So we said, okay, we gave them straight contact. We said, give the list to the NICD so that they will be followed. So if they had been missed, they would have now been found. And we're going to have to keep this message going, because it is possible that someone could be would be asked to go on quarantine. And in the process, we ask them, who did you meet? He counts all of the people, he forgets certain people. But when the story gets to come out and someone says, oh, but I met this individual, then you must come forward, so that we must include you into the list and then take the necessary precautions. So it's just an understanding that this is how we do it, but it doesn't mean that there's a risk. Now, when someone has been negative or they didn't have symptoms when they met, they are not likely to spread the infection. We do know that there's a bit of an overlap where maybe someone before the symptoms set up might be releasing the virus, but we think that that amount might be lower because it's asymptomatic, because largely the virus comes through the droplet infection, so the sneeze, the cough, and so on. So if you are not coughing, you're not sneezing, and you're not lacrimating or releasing tears and people are touching them, you may just maybe use your hands, and therefore some virus will be in your hands and then it might be spread. But it's less likely at that level. So I'm just explaining it so that we don't get, when people say, oh, but I was also part of that, just come onto the list and then we'll just look after you. That's the approach.
Thank you, Minister. Shall we take 2 more yes? This row and 2 on this second row. Please introduce yourself once again.
Hi, Minister. Gallo from ENCA. I would like some clarity with regards to the numbers. How many people are being tested for the COVID-19? Also, with regards to some schools choosing to close their doors, in particular in Johannesburg, Grayston Preparatory School closed today because it's alleged a teacher there is being tested for the COVID-19. Can you please confirm this? And at what point will the country be issuing travel bans to the Western areas like Italy and China? Are we waiting for somebody to die, perhaps? Yeah, I think those are my questions for now.
No, I don't think we must let that one go. I don't think it's a fair question to say waiting for someone to die. I think it's a very unfair question to pose, because I don't believe that you can actually expect a government to wait until somebody dies before we act. So I think that question is not correct. Now, we said earlier that the issue of travel bans, the meetings, the large meetings, we've had a discussion, and then the ministers will be consulting with the president and the cabinet, and thereafter any messages, any announcement will be made at that kind of level. Then it will be explained what is being done on what basis. And then I said the fact that we have had the discussion does not conclude the issues. There has to be consultation with the president, there has to be consultation with the cabinet. So if there's any issue, that will be at the point at which it will be done. Minister Pando was here saying that the major concern has to be about the safety of the citizens. So I really think that it's not fair to create an impression to the public that there's a government that's going to sit there and wait for people to die. I don't think it's correct.
Shall we take the next
Grayston Preparatory School?
Yes, those stories are going around. We can just check if anybody's got more details. All we can say is that when we pick this up, we send the teams to check what was the issue. There are a number of people who would have been the contacts of the people that have been contacted. So what then happens is that if someone is contacted to say you are on the contact list, until we explain to those who are associated, sometimes they react in a different way and close the school. So for example, we went to Cowan School because they closed the school. And then we have gone back to them, they'll open the school. We just need to make sure we link up with them, explain the circumstances, and then we'll tell them where the risk area is. And we keep saying that for anyone who was exposed to a contact who was asymptomatic, they shouldn't worry too much. We'll test them and check if there's but the risk is lower. So we will follow up and check. I'm not sure if anybody has found. We did hear about Grayston on the social media, but we can just check if anybody has got more details. All we can say is that a number of people who were part of the contacts, then of course send messages that we have to keep following up on those.
Thank you, Minister. Yes, please.
Zianda Ngobo from Newsroom Africa. Minister, I'm in possession of a message of someone who actually flew in from Italy, northern Italy via Zurich yesterday, and they say that they were not checked. Nothing was done at the airport. So my question is in relation to your screening processes, in particular when it comes to ports of entry, and perhaps also Home Affairs Minister, you could come in here at your Home Affairs offices. What exactly is being done in terms of your containment measures at ports of entry into the country? Another question of clarity, just to follow up from my colleague, just to be very clear, the teacher who is said to have been part of the group that went to Italy, Minister, are we saying that they are not part of the latest 4 that have been confirmed to have been infected with COVID-19? And then there's talk of RK Khan in Durban possibly being quarantined because they're expecting a case. Are you able to confirm whether or not this is true?
Sure.
Okay. I'm going to ask the team if they are aware of who the teacher is, but any of the people who are here would obviously mean that there would be contacts of a number of people to say they need to be quarantined. But in terms of what we do when people land here, we identify various areas where there would be a risk, and therefore we will screen those. Now, there are a number of things that we do. In those areas where it is clear that people are coming from an area where there's a high transmission, we would then go and ask them to get questionnaires, that they would be answering those questions so that we can identify the risk, and we rely on self-disclosure here. Secondly, we would even send a team fully clad with the protective gear to walk seat by seat to check their temperatures and be sure that everyone who is there is looking healthy. If there are suspicions, we then take them to a clinic for testing, and at the same time we would also, for those who are identified, we'll then take the details of those who are 2 seats before, 2 seats behind, so that we can follow them up. What may happen, though, is that someone could come from an area that may not necessarily have been identified as a high-risk area, but they know where they come from, but the flight doesn't come from there. So that is another thing, and this has been found to be a challenge in a number of countries where they actually impose travel bans to say no flights to China, no flights to such and such a country, and people come from those countries not via the airlines that were being watched. They come via other airlines. So people still get there, even though when they get there, they use other flights which were not necessarily designated. So those things will still happen. But as far as we are concerned, we continue to screen and make sure that those who have got symptoms and those who are looking that they need attention, we give them attention at that level. You wanted the Minister of Home Affairs to also say something? Come this side.
Yes.
You can come this side.
Thank you very much. Yeah, you're asking about the ports of entry. The people who are doing the testing in the ports of entry are from Port Health. That's the Department of Health. So whatever the Department of Health has told you, that pertains. But this morning, Port Health, and they are here, I'm sure they can confirm it, has just confirmed that they've hired 94 extra people. Yeah, maybe he can take over the chief for health. Yeah, it's Port Health. In Home Affairs, there's no separate team from Home Affairs that tests people. Everybody who tests you there know that it's from the Department of Health. And so the 94 they've hired includes nurses, but he can take over to finalize the matter.
Go ahead, Dr. Anban.
Thank you, sir.
Dr. Anban Pillay, Acting Director General of the Department of Health.
The feedback, sorry.
Is it my phone?
I think that it's important to bear in mind that when a flight lands, the team go on board and do a thermometer test on every person. Thereafter, when they come into the immigration area, there's a second scan that's done on every person. They also complete a questionnaire where they've been through an area. In fact, we have lots of compliments from many European countries where they were saying that the screening that happens at OR Tambo and Cape Town and Durban is far higher than what they've experienced in their own countries. So I think we're certainly screening. Maybe the individual that you're reporting on was not aware that we're screening. Minister, I think the other questions the team can maybe answer.
Yes. Who wants to come in?
So in terms of the contact, the cases that we have, there is no teachers in the positive cases. We can confirm there are no cases or teachers. The teacher in the school is a contact of one of the cases. The teacher will be under surveillance. And if they develop symptoms, they will be tested. And we will notify of the result. If they are positive, we will notify the minister.
Okay, we're moving on. Second row, the gentleman there.
It's done. Number, okay.
Yeah.
I wanted to understand the number of people who have tested positive up to this stage is 7. You are fine there. The number of contacts tested we can't give you now. We can look for that, but it's a number that's going to keep rising. We don't even have a full total of all the contacts at this stage. We did say yesterday that the first patient we had about 25 contacts to trace. The other one was 18 contacts. So we will count and then we'll give you. The number will keep increasing. But the number of people who have been tested in the whole country before is over 300. We don't have the exact figure because the number keeps increasing. And this was just to screen and check if anyone is positive. But if you want the numbers of contacts tested right now, we are not ready with that.
Thank you, Minister. Yes, please.
CNBC Africa. Ministers, there was a briefing on Friday where members of the Portfolio Committee of Health met with AXA. It was said that testing was going to be ramped up on Friday to include both domestic and international. I was at the airport over this weekend. I did not even see a single person getting tested. So I wanted to know where we are with regards to testing on the ground, because that is not my lived experience from this weekend. And secondly, I wanted to know with regards to the ports of entry. A lot of emphasis is put on the airport side of entry, but we do have land entries as well. Where are we in that regard, and what are we finding? Thank you very much.
Can we take another question before the Minister? Yes, please.
Minister Mkhize, my name is Brian Sokoto from The Citizen. I just want to understand whether, in the light of the crisis that the country is facing, is government investigating an effective use of technology in schools so that in an instance, for example, with lockdown, they don't need to go to school, but you can maybe tap into technology.
Shall we take another question, please? Yes.
Minister, CCTV, China State Television. This is more context without being specific. Is there a global health plan that we subscribe to in this country? Because I'm under the impression that it was mentioned there was a possibility of an epidemic respiratory virus in a report that came out today. Even if that's not quite true, China had unfortunately become the test case. What China did, is that the right kind of steps to take with lockdowns, etc.? Is it effective? And is it, sorry, it's gone. Is it the most efficient way to deal with an epidemic or pandemic respiratory virus such as we've got? That leads into a second request question. We've had 7 cases in 6 days. We do have to be very proactive in this country because we do have some fairly unique health issues that exist within this country. Referring back to China as basically at this stage your poster child, is that what we should be using as examples? Who are we turning to for help because we are economically challenged? And what kind of help can we expect from the international community? Because when we don't know how we're going forward, I think it kind of feeds into the uncertainty and the panic that we're experiencing among general citizens in the country. Thank you.
Shall we take just another one before the minister responds? Please, we'll take another round.
Deal with these issues with China.
Okay, fantastic. Brandon Lama from ETV News and Sport. Just a point of clarity, please, Minister Mkhize. Just want to know when we may expect the results of the final 2 of the 9 that had travelled to Italy. And because you said those results are still outstanding, we just want to know in terms of when we may receive those results, because I understand it's a 48-hour window. Thank you so much.
Okay, then we'll ask the minister to respond to those, then we'll take another round.
Thank you. We're going to ask the members of the team to deal with some of the questions. So if we can just get closer, and so that we can have the.
Okay.
We can swap chairs. Yeah. Who's going to?
No, it's fine. It's fine.
No. You want to come over?
Maybe I can come this way.
Yeah, we can swap. You can come and sit here. Yeah. Whoever starts. Please.
So
Please introduce yourself.
Good afternoon, I'm Dr. Natalie Mayet. I'm with the National Institute of Communicable Disease, a division of the National Health Laboratory Service. I am the chair of the incident management team together with Dr. Patrick Manasa from the National Department of Health. In terms of the question for the preparedness plan, South Africa has developed a pandemic preparedness plan already in 2016 that was signed off by our erstwhile Honourable Minister of Health, Motsoaledi. That plan has been revised to meet the requirements for if we are going into a pandemic preparedness phase. All the work that we are doing is aligned with that of the World Health Organization, and all the policy guidelines are benchmarked against international best practice and recommendations from the WHO. Thank you, Minister.
Nothing to
add. I think in terms of our ports, just to mention that testing happens at our land, sea and airports, that all 3 of them are being tested. We had instituted, in addition to our international arrivals directly into the country, also instituted testing through our transit area. So our transit area is also being tested, so transit through South Africa into our domestic as well as to our international sites is then being tested. The Portfolio Committee for Health visited and confirmed the testing is going on. I know you're shaking your head, but we can show you evidence of the tests that have gone on and the questionnaires that have been completed by international travelers that have come through South Africa.
Sorry, no, it's fine, it's fine. It's fine. I don't know what the Portfolio Committee said. I see you shaking your head, but the issue is that the Portfolio Committee went to observe the testing, which is largely thermal scanning, and also the inspection in flight, and the issue of questionnaires, and what we do when we refer people to the clinics, and that in fact we do have an isolation center at the airport. All of those things are in place, and I've been there, so I know exactly what we're talking about. The issue of increased testing meant that whenever we have new places where we believe that there are concerns, then we add those. Initially, we were only focusing on China and the airlines that came from China because that's where the epicenter of the infection was. And of late, we have actually focused on other countries as well. So increased focus and vigilance meant that. And in addition, when we started, we just focused on just thermal scanning. With time, we increased the issues in terms of in-flight inspections and all of that, but then we also increased the level of protection on our staff, wearing gloves and wearing masks and so on. And so initially that was happening on the international side. We've actually extended it now to some of the domestic, on the domestic side. We also dealt with Well, I think we need a discussion because it's difficult to deal with it if you're going to be responding to us as we're trying to answer you. So we need to probably just meet and explain your issues outside, and it doesn't then fit onto the setting we're in. I think we need a discussion. But let me just finish in the process. So the issues, therefore, from where we sit, inside the domestic side, we're not testing anyone, we're not scanning them. We're scanning people who are coming from outside. That's the nature of the problem as we're facing at this moment. We don't have yet a lot of what we call domestic spread of the infection. We're actually dealing with looking at where the risk area is coming from. So those are some of the issues that we're dealing with. We haven't discussed with the department in terms of the issues of using technology, and so it's an issue that we might probably just raise with our colleagues, but I think it does have its own challenges because technology basically means that you must have good connectivity, you must have enough gadgets for people, to tablets and so on, for the students to be able to have access to Wi-Fi and so on. But I will not respond to it categorically, just to say that we haven't really discussed that issue with the department. The issue of the plan that we follow has been asked. We're following more the guide from WHO, and that's where we get our primary guidance. Everything that we use is guided on the basis of what the WHO has to say. And so we have noticed that various countries are doing various things in terms of dealing with this. And certainly we're seeing the successes of China, numbers of people being reduced. And we hope that all the countries will be able to get to a point where we can show each country to country experience of how we manage to contain the diseases. So the main assistance we look for is technical support from WHO, and that's really kind of international assistance which we normally get, and that's really what we're focusing on. Otherwise, we are also free to interact with various countries. Our team interacts with various specialists and clinicians who are dealing with this issue in many countries. I'm aware that there's been very several discussions with people in Canada, in the UK, in the US, and other countries. So we actually are open to interact with people from different parts of the world.
Thank you, Minister.
Sorry, the last question was the results. Well, we've just given you some results, and when the others come, we'll make them available. So we should expect that maybe some results might be available tomorrow, maybe might be day after, but as soon as they're available, we'll make sure you have them.
Thank you, Minister. Just to say that the DG and I were at the airport when the portfolio committee visited the airport. And I'm encouraging the journalists to contact any member of the portfolio committee about whether the screening was taking place or not. But the DG has said that they were quite happy. I'm really requesting you that maybe you should, without any mediated communication, you should actually contact them directly.
No, but the screening is going on. What sometimes is a problem, the screening, you are not going to be touched by anybody. You stand at a distance and they look at the gadget at you and then let you pass. So you may not feel contact with anyone simply because of that. So that's one of the things that you must just remember. It's just unfortunate that if you are not, we can't take you there because it's a security zone. We can't take you onto that side. But we know it's happening. We inspect every now and again, and so there's no problem.
Thank you, Minister. I'm taking hands that I've not taken before. Yes? And yes, here. Please introduce yourself.
Okay.
There should be a mic there next to you.
Yeah.
Just lift it up, yeah. Sorry.
Okay, thank you very much. It's Chekwane Tladi from ETV News. I just want to ask as to how safe is our port of entries and exit as well, bearing in mind that those who go out might come back with the virus. And as well as I want to know about the the arrangement about between the government and the tourism sector, in a way that those who were already booked their flights and their vacation to go out, what is the arrangement in terms? Are they cancelling them or are they postponing them?
Thank you. Another question? Yes. Please switch off the mic.
Siso Zulu, Eyewitness News. Lancet has now offered people to go to their labs to test at a cost, of course. But what happens to people who do not have money but want to test? Are there any options for citizens, perhaps who don't have money, want to go test, who believe that they're showing symptoms? Another request, could the Minister of Health please repeat the details of the individuals, the latest individuals who have tested positive? Where are they? I believe they're from KZN, but I missed the ages and the areas that they're from. Thank you.
Good afternoon. I think I'm loud enough. Good afternoon. I'm Criselda Lewis from SABC Television. There's one aspect, Minister, that I wanted to get some clarity on. Are you aware of South Africans that are panic buying? We went to several health stores a couple of days ago, and you would find in the aisles most places where you would find your hand sanitizer that's completely out. I know that some of the health stores have actually sent some statements out saying they're not going to increase their prices, but they do acknowledge that there's a bit of panic buying that is taking place. Are you aware of that?
Thank you, Criselda. Any other question before the Minister? Yes. Then we go ahead.
Come sit.
Just clarity with regards, again, Minister, to the case in the Northwest. I'm not quite sure if you said somebody was being tested or they were testing positive. Just some clarity on that. And the cooperation between the task team as well as the National Health Education Department, rather. What is the collaboration there? Because we are seeing that schools will be shutting down for a day or two, sort of as a precautionary measure. And lastly, if you could just clarify the reports around the students who from Limpopo came back. There was a radio station reporting that they weren't tested when they came back from China.
Yes, thank you.
Hi, it's Yanda Ngogo from Newsroom. Minister, just as a point of clarity, by your own admission, you did say that sometimes people would come, let's say, from China, but maybe they won't come, via an airline that comes directly from China. Maybe they'll go via Zurich or whatever. So how then are you detecting that, Azianda was in China or was in South Korea, even though I may have been a different airline? And how are you making sure that you're not missing out on people who come from, high-risk areas such as Italy through your detection process? So just procedurally, please just take me through that again.
Thanks, Yanda. Maybe take the last one. Yes, please.
Tato Marisa from the Sowetan. The people the group that went to Italy, they seemed fairly young, and the initial understanding was that the people who are mostly at risk are the elderly and those with the weak immune system. What are the commonalities that you have found with these people? I mean, they're ranging around 38 and 45 or so. What are the commonalities, and was it a weak immune system, or now are we saying that even the people who are a bit younger are now at a much higher risk? And the second question is on the repatriation. Can you confirm that the people, the center for the quarantine is still in Tabanchu, or are you now looking for another place? Because there were rumors that that deal had fallen through and you were now considering another place. Can you just confirm if it is indeed that the place that you initially spotted? Thank you.
Minister?
Okay. Well, let's first go through the issues of people who are going in and out of our boundary. The real issue here, is people need to be in contact with an area where there's an infection. That's where the risk, excuse me, that's where the risk comes from. And therefore, whether they come into our country having been exposed, or they come from here having made a contact with someone who's infected, the issue is the contact. So as far as our borders are concerned, we have not restricted the movement of people through our borders. What we have said is that we will try and detect symptoms, so that people who have got symptoms must be the ones that we focus on. And so it doesn't make a difference whether this is port of entry as a land port of entry, or it's in the airport, or it's in from the sea. We will still scan them all. We're doing it all over. So that is the precaution that we're taking. The issue that relates to cancelling of tourism events, conferences, sports, and so on, there's no decision on that. But as I said, the ministers were discussing those issues, looking at a lot of information, and therefore they are processing that matter. As soon as they would have done consultations with the president, with the cabinet, then they will be able to make the necessary announcements at that point. So we will work on it on the basis of what the ministers will do, because some of those issues are actually going to be a response of a particular minister. The Lancet laboratory, we have seen the story in the media. The arrangements that we have between the private and public laboratory, that at the moment the COVID-19 tests were being done at the government hospital, but then the private laboratories would refer to that laboratory. But they do test people for other viruses. So in the process, when they test, they'll probably charge them. But if there's any new arrangements, I'm sure the team is going to confirm, but the structured arrangement was, whether it's public hospital or private doctor, like this first patient was actually seen by a private doctor. The test was done by a laboratory, Ampath, who then referred it to the government National Health Laboratory Services. That's where the test was actually done. But the specimen went via a private laboratory. So there is a working relationship at the back. And so if there are new arrangements, I'm not aware, but the members might even indicate that. Then, yes, Griselda, we're aware of the panic buying. And I think it's all linked to the anxiety of people who are worrying that something's going to be finished, and then all of a sudden, what will they do? I want to just say that the hand sanitizers are not really a problem. What is critical, the basics, is just soap and water. So even people didn't find the hand sanitizers, they must not feel that they've lost out, that they are now unsafe. They must know they can actually use soap and water. That's more standard and much safer, more available, and that's what I think we need to focus on. But I was talking to somebody today who was relating a story of someone out in the US. The panic buying is not just South Africa, it happens in other countries. And in some areas it looks like people are already stocking food. This is other countries. In case I go to quarantine, let me buy myself all the grocery for so many weeks and so on. So these things will happen, and we must not be surprised. What we need to do is to keep assuring our people that the situation will not need them to go to those kinds of extents, and that we will be together as we work on these issues to try and find ways to make life easier and more bearable for them, so that we can then get people to continue on the quarantine. The question was, who asked about the Northwest? Yeah. Yes. Now, the Northwest was just to deal with a situation to avoid fake news for you. It was just to say you must have as much as what information that we have, so that you can contextualize if issues come up. If someone, in this case, someone was ill in Northwest, has not traveled out of the country, and had some symptoms, and of course, as expected, the doctors thought we must test this one, and then they tested the individual, and the test came up a little ambivalent, which means you may not be able to see whether it's completely negative or completely positive. It was kind of in between. When you get that situation, you must repeat the test after a certain number of hours. When you repeat it, you then have to, it will actually be clearer. It will either be positive or negative. So when that happened, we were watching this particular individual, and the individual is not positive, is negative, so we're getting them out of the system. They become part of the as many as 300 that we say we have tested that have come out negative. We don't even talk about them because we just need to ensure that we test so that we don't lose any patient in the process. So we're not worrying about that one. The person must continue to be treated. The Department of Education, we do interact very closely with the Department of Education. We have not issued a call for any school to be closed. So anywhere where there might be a problem of a school being closed, it's an ad hoc situation. It just means it has just happened on the spur of a moment, and therefore we'll then engage the MECs and then try and address that situation. It's usually a factor of anxiety, particularly of the parents who worry that their children might be infected. So again, we'll just talk to them and ask them. I did give an example where we went to talk to the parents. They were really genuinely concerned, and some were very anxious. But after we had clarified a lot of issues, they were able to relax. So I think we should just, each time we find out, we'll then talk to them, as it were. It has been explained what the situation was with the particular individual. In Limpopo, the students came from China. Here, we have only focused on Wuhan, where we will quarantine people who have come from China. And anyone else who came from other parts of China, we have not imposed any obligation on them, and we have not even restricted travel to China and from China, except for Wuhan. Wuhan is based on two issues. There was a quarantine and a lockdown, and then the numbers of infected people was highest in the whole of China in Wuhan. That is the reason why we actually are focusing on Wuhan. The rest of the parts of China, we don't have a problem with that. Now, so a number of students have been going to China and coming back. We don't bother about them because we don't believe that they are in any way infected. Now, there are a number of provinces that subsequently took certain precautions just to restrict movement in China, but they are not as bad as Wuhan in terms of the numbers of patients who were there and the level of infection. So we know that those were precautions that they took. Now, the students who have come from there, to start off with, they would never have been allowed to come out of China if they still needed to be in quarantine anywhere. So we must just understand China has been very strict on that, and we actually think that it did help. And so in this case, those students did not need to be quarantined. And now we hear some of them were calling to say, why aren't we taken for quarantine? Well, the answer is that they're not taken for quarantine because they don't need quarantine. If they have got symptoms, we'll deal with them like people who come from any part of the world, and then we'll deal with it at that level. So we just would like them to calm down and not be too agitated about it. We wouldn't have allowed them in if we thought that they needed attention. Had we had that they were coming, we would have said, no, they must not come, they must go through quarantine, blah, blah, blah. So we didn't do that because they don't need it. So, but everyone gets anxious. Oh, what about us? What about us? We just need to explain, no, they mustn't worry too much about it. There is no problem. But if anyone has got symptoms, yes, they're entitled to be checked and so on. What we also don't do, we don't just go and do a routine check to say, hey, you know what, I just want to know I don't have coronavirus. We don't do it like that, because the problem is that there has to be an indication with specific factors that will help take us to that point. So the one issue is you must have symptoms. And then if you don't have symptoms, you must at least say you come from an area where there was a high level of infection, and therefore can give you that attention. The issue of no direct flight, we can never claim to be absolute and perfect. We have, for the past 8 weeks, not had a single person who had tested positive for coronavirus in South Africa, but other countries have. And the reality is there is no way anyone can stop everything that would allow people to come in with the virus. You do your best, you do what is advised based on the guidelines, and that's what we do. So if we pick up someone who could have slipped through the crack, we just deal with it from that point of view. We're going to be announcing some of the issues, some of the guidelines, so that people can at least come forward and indicate that they would need to be observed and so on. We'll get to that point, but when we do, it will be more because we just want to increase the level of vigilance. But people who have a virus have got their own responsibility to actually try and come forward and give us that information. I'm going to let our team to deal with the issue of young and elderly, although all we can say is that you can get an infection. The youngest person that got the infection was a 30-day-old neonate in China. And another one was about 8-month-old in Australia. So you do get the infection, but I think Dr. Kerrigan will go into that. What they normally refer to largely is the fact that there's not been a large infection from children to other children. There's a distribution of people who get severely affected by the illness. They are of a particular age group. So I'm going to ask that Dr. Kerrigan McCarthy breaks it down for you, but it's largely about the severity of the disease as well as the mortality and so on. We'll ask them that they deal with that. The other issue, the last one which I want to deal with, yes, we have looked at a number of areas, and we went to 84 sites. Yes, Tabanchu was amongst them. There are many others. We are actually narrowing the numbers down to a point where we will then be able to close the issue, sign with whoever we sign with. And so when that is done, we'll announce which one ultimately. And all we can say is that, yes, we have looked at many facilities. But as we said, once everything is closed, we'll then announce it. It doesn't really help us to go into the speculation and debate on issues that we have not really finalized and concluded. If I could just ask of the outstanding issues. Maybe you should come and sit here.
We can use that one.
No, come and sit here because the mics are here. Yeah. Makes it easy.
Thank you, Minister, for the opportunity to address you. With regard to the ages of the affected South Africans, they were all members of the same party that travelled to this particular ski resort in Italy, in Lavinia.
Here's what I found on the web.
And it's highly likely that they had what we call a common source exposure. So if we look at the time of onset of their symptoms, they were all became those who came. There were 2 who were tested positive that did not have symptoms, but amongst those who had symptoms, the symptoms began within the period of a week. Now we know that the range of incubation period is from 2.5 to 12 days. So it's highly likely that they had a common source exposure. As our minister has shared, the information that there is globally about the what we call the natural history of the disease, that is the disease progression, suggests that the elderly, those particularly over the age of 75 years, are at much greater risk of severe disease and a poorer outcome. But all humans are vulnerable to the disease. Children have been recorded in case series, but those under 15 are exceptionally uncommon compared with adults. So the science behind why children don't appear to be infected or to have asymptomatic disease is as yet unknown. Thank you. And then there's one other point I wanted to make around testing. When we talk about screening at the airport, we test for fever. The testing that is done where we take a throat swab looks for the presence of viral RNA in the throat. Now, this is only present when a person has symptoms. So this test is not able to detect people who are in the incubation period, people who are asymptomatic. And therefore, it does not help for persons to ask, persons who are asymptomatic or who are worried, we call them the worried well, to undergo testing. The tests that we have at the moment are unable to identify persons with asymptomatic or persons who are in the incubation period. Thank you.
So can you just ask, because I think the question, the way it's asked, let's deal with one other aspect which will help the question, the one who asked the question. The grades of the disease, mild, moderate, serious, and critical, how that is spread, as well as how we approach treatment to all of them, just to give a sense, because that's, I think, what the real concern is.
So in the large case series that are coming out of China, it seems that 80% of persons have mild, what we call self-limited disease. That means it gets better on its own. It's like the common cold or flu. A person may experience body aches and pains, a little bit of tiredness, and then they may get a fever and a dry cough. 20% of persons have more severe illness, of which 15% of persons may require hospitalization for treatment of a viral pneumonia. So they may need supportive care such as oxygen or fluid to accommodate for or to treat their dehydration. Around 5% of persons who get this infection are critically ill and may require some kind of more intensive support in an intensive care unit. And on average, 2% of persons die. Now, that is an average across all infected persons. It is higher in the elderly and negligible in the young.
I'm sorry to do this to you, but can you just deal with one other aspect? I think it's important as well. The issue of viral shedding, and then the issue of direct treatment for the virus, something that treats the virus and how we deal with it. Because you see, the questions as they come, we need to share that information so that there's an understanding as to how we approach the treatment. Please.
So, as you can appreciate, this virus is a new infection globally. It's only been discovered since the 7th of January, and today we are on the 9th of March. That's 2 months, 8 weeks. During this time period, what is emerging from the scientific literature is that the virus is shed from the throat, from the upper respiratory tract and in the lower respiratory tract sputum, round about the day that symptoms begin. Sometimes it may be shed just before symptoms start, but not significantly before in terms of time. The virus is then reaches its peak of shedding within 2 to 3 days after the onset of infection, and then viral shedding begins to decrease. In an uncomplicated infection, the illness lasts a period of less than 2 weeks, much like the common cold. In a more severely ill person, that may take longer to recover. The virus shedding eventually decreases to zero by the time infection symptoms are past and the person is better. And that reflects the body's ability to control viral replication and to stop the virus. In other words, to self-heal, to cure. In terms of direct antiviral treatment, at the discovery of this organism, or when the organism was discovered, there was no known antiviral treatments. However, a lot of research work had been done looking for treatment for the SARS virus, which caused the SARS outbreak in 2003. And science has shown that these two viruses are highly similar. They are very related, although not identical. So early on in the virus trajectory in China, a number of clinical trials were started using antiviral agents that were initially thought to be active against this original SARS virus from 2003. These include a drug called remdesivir, and another drug called lopinavir-ritonavir, which is very well known to us in South Africa. It's one of the essential drug list treatments for HIV. It's an antiretroviral drug. The trials for these drugs, the early trials, are not yet available, and so there is still no evidence-based direct antiretroviral treatment. This is another one of the reasons why we need to do our best as communities to contain the spread, because the longer it takes for the more time the international global community has the ability to perhaps develop and propose new treatments. The other kind of antiviral, not necessarily treatment, but prevention, is vaccination. And the good news is that the WHO had a research and development agenda which was implemented and developed after the Ebola outbreak in West Africa in 2013. The Coalition for Epidemic Preparedness Innovation, CEPI, C-E-P-I, has funded the early stage development of a number of vaccination candidates to treat the 5 identified potential pandemic threats that were identified by the WHO. And so this research agenda has been directed in the recent weeks to creating a vaccine for this coronavirus. The chair of the WHO estimated that with all going well, unfortunately vaccine development will only be ready around about 18 months from now. That is because there are a number of trials that have to be done before drugs, and of course scale up in production before vaccines can become available.
Okay, just the last comment on the same strand is that when people present, there are those who have said to you are asymptomatic. That means they don't have a cough, no sneeze, no chest pain, no fever. Then the reality is that not everyone really needs to be hospitalized. The doctors have to make an assessment whether the individual needs to be hospitalized or to be treated conservatively. Now, conservatively basically means we will look at you, and then if you don't have anything that's making you uncomfortable, we just wait. We're waiting for the viral shedding, which means that by a certain time, your body will develop enough immunity to destroy the virus so that it's not detectable in your body, and that when we do the test, we find that the test is negative and you are not infecting anyone. And then you are free to go to the public. Now, why we're telling you this is because of all the people that we are seeing. One day you will hear that so-and-so has not been taken to hospital. Maybe the doctors assess and say, okay, stay at home. That is because maybe there are no symptoms. In other words, you've got the test positive for the virus on your body, but there's nothing for the doctor to treat because you don't have any symptoms. Now, I want you to understand that, because even if you have symptoms, the treatment is not to the virus. It is to the manifestation of the infection. In other words, you can develop a pneumonia with a complication of this infection. We'll treat you for the pneumonia. Once you recover from the pneumonia, your body is strong enough to fight the virus on its own. When we treat the cough, we stop the cough so that you can settle and your body is strong enough to fight the virus on its own. If you've got a sneeze, and so on and so on. We do it like that so that you can just understand that the approach, it doesn't necessarily mean now that Zolim Kiza is tested positive for coronavirus, take him to the hospital. It may not always go that way. And so there may be merit in assessing the person and saying, stay in your house, report if you've got any problem, then we can deal with you in that way. The 2 weeks period works for those who have got a mild or moderate illness. If your illness is more severe, the viral shedding can be even longer. It can take up to 6 weeks. So those are some of the intricacies. We're finding it an interesting issue as you go and read about it, so that when we talk, you will just always understand that there's quite a lot of assessment that has to be done and decisions that must be done in terms of how to treat the individual. You mustn't be alarmed when you hear something, because the next person is going to say, but why is this one not in hospital? I've already been asked that question. And we must not be alarmist. The doctor will say, we will not keep you in hospital. You don't have something for us to treat. Just make sure you don't infect anybody, that's it. We'll keep checking you every second day until your test shows that the virus is no longer in your body. So I just thought we must explain that, because as we move along, you mustn't find some contradictions in the way that we're doing things. You must just understand that there are various permutations that we have to work with.
So, thank you so much, Minister. That was really spot on.
Sorry, Minister, just the clarity on the 4 cases again, on who we are. There was a question, I just the clarity.
They asked the question. I thought you heard it. I was going to tell him quietly alone. Eh? All right, let me take you through again. Okay. Now, let me walk through everybody for you, right? The one that was first discovered, 38-year-old male, had symptoms, is from KwaZulu-Natal in Pietermaritzburg, and has been symptomatic and was tested around the 3rd, and therefore that one was taken to hospital. And that one, oh yes, just as well you asked the question, because there's something I should have told you as well. That one, at this point, about 21 contacts have been conducted, okay? Then the second one was a 30-year-old female who had no symptoms. No, this one had symptoms but went into quarantine, is in Gauteng. On that one, we have now conducted 13 of the contacts. Then the third person was the wife to the first patient, 38-year-old, had no symptoms in KwaZulu-Natal, and 15 contacts have been conducted already. Then the following ones were the ones we announced today. One is a female, 38-year-old, and is now on quarantine, and had symptoms, and the test was positive, and we have identified 16 contacts. As long as you remember that 16 contact is memory. If we find some new contacts, we will update. Then the next one is a couple, the husband to that one, who is now 38 years old, also is now in quarantine, and has no symptoms. And he has also got 15 contacts. Then the next one is a lady, is a male, he is 45-year-old, and also in KZN, and has symptoms, but also has tested positive, and 12 contacts have been identified. The next one is a male, 38-year-old, from Pietermaritzburg, and this one also has some symptoms, has got symptoms, and very mild symptoms, but also is improving already. But that one, 13 contacts were identified. The one before, I did say, is 21 contacts. That is, oh no, I'm sorry. The last one is 21 contacts, yeah. So that's the last one. The 13 I mentioned earlier. So the last one is 21 contacts. So that is the profile of all of those individuals. We still have others that we have tested. As I've said, there are many more contacts that are being tested. We will talk about them if we find that any of them are positive. But the first lot of the outstanding, probably another 4, we hope that in the next 48 hours we'll also have a sense as to what has happened to them. So that's really how far we can take it.
Minister, there was a question about the quarantine area.
What was the question again?
Quarantine area.
What was the question? Yes.
Toilet, but it wasn't in food. Did that deal, because my understanding was that there was a deal, did it fall off? and now you are now looking at also just to administer the self-quarantine. I mean, you're always saying people are self-quarantined. How effective is that? And should people not be worried that you may say they're in self-quarantine, but the other one just decides to go buy a graded spa and then infects our tellers?
Yeah, I think now we need a fireside chat with you, because I've answered the question. I did say that at the moment we have no basis to doubt that when someone is being told that a matter affecting their health requires them to stay at home on a quarantine, that they would not have done so. We've also said that we ask them to disclose their whereabouts, where they've been to, who they spoke to, who they had sat together with, so that we can track all of those people. We even say if anyone else says that they were with a particular individual, and if maybe someone had forgotten, we take it serious. That's why I gave the example of the children, someone who said was at school with the children and so on. Then we actually send give us the list to go and check if those people are in the quarantine, in the contact list. So there is no big issue there. So we will just keep updating if there's anything that's a shortfall. Where we suspect that someone may not be able to manage the quarantine, we'll obviously have to deal with it as we arise. At the moment, it hasn't arisen. Now, I have said we looked at 84 sites. We narrowed them down to a number of them, and we have said that we did look at the one in the Free State, in Tabachu. We will only announce once we are closed with all the things that we're doing. Anything else, we are not able to tell you. We can just say we have looked at a number of them. If you've had, maybe we've been to a place, you had that people say they saw the Department of Health and the Military Health Service there. Maybe they did. We're not going to argue that. We simply are saying when it's finalized, we'll announce it. Thank you very much.
On that note, colleagues, I wish to thank the Minister and all of you for really being patient with us and for answering this